Good morning, everyone. Thank you for being here, and we welcome you. Thank you, members of the media, for joining us to the Boil Water Notice press conference. We are at the McKendrick Ochoa Salinas Branch Library. If you may allow me to introduce Mayor Dr. Victor Trevino to initiate our conference.
Good morning. Mayor Dr. Victor Trevino. As we continue with the Boil Notice, the investigation conducted by the city in coordination with TCEQ has narrowed down the potential source to an area in central Laredo where we believe that the source of the E. coli contamination may be located. These locations are between 1 to 1.5 miles of each other. Unfortunately, the same investigation shows that the overall problem is multiple years in the making, and we are now playing catch-up to a problem that has grown to what it is today. I have requested that areas impacted be kept in a boil water notice and the non-impacted areas sectioned off safely, and that they may be released from the boil water notice. Currently, there has been no laboratory-confirmed reportable cases of E. coli as identified by the Texas Department of State Health Services, and the testing continues at the water production and wastewater testing sites. However, as a doctor, public health and safety continues to be a priority because of the existence of E. coli. While it can have little or no impact on most people, the level of danger posed by E. coli depends on the type of E. coli, the amount consumed, and the person's health. This is why it is important to boil the water for at least 1 minute before drinking it at this time. These are the CDC guidelines. I would tell the public, as I tell my patients, that I would recommend this specifically for children under 5, the elderly, and people with compromised immune systems, who are the most vulnerable to E. coli-related illness. And as mayor, I have been to all the water distribution sites, handing over water and speaking to people at these sites, and I agree with them that we should not be living in this way. I also agree that people feel disrespected. One thing that I strongly believe as a doctor and as a public servant is that we are not here to do the easy parts of the job. We are here as elected and times like these to tell people the truth of our situation, how we're going to get out of this mess. This is the heart and soul of public service. For that reason, after my next meeting with TCEQ this evening, I will be calling for an emergency meeting of the City Council, where I will ask my fellow council members to stand beside me and support me in this effort, because the public is tired of having to deal with this boil water notice and tired of being ignored. I will specifically ask for the following items to bring everything into alignment. I will be requesting that all available resources be diverted to deal with this water infrastructure crisis. I will be requesting for a pause or elimination of non-essential projects to focus on these funds of replacement of pipes that have exceeded their shelf life. I will be requesting that the public receive a discount for the water bill. I will be requesting for the immediate approval for the new interim utility director that will start on October 21st. This individual will be a turnaround specialist. These are some of the items I will be requesting. I know and have faith that we can fix this if we can focus on the problem at hand. Before I pass the podium, I would like to thank the city employees that continue to work very hard for our public. I also want to thank Senator Zaffirini, Representative Richard Raymond, Representative King, for their collaboration in this difficult, challenging time for our public. Before I do that, I would like to summarize this in Spanish. Buenos días, doctor Treviño, mayor de la ciudad de Laredo. Continuamos viendo el problema de el hervir el agua. La investigación de la ciudad en coordinación con TCEQ enseña que la fuente potencialmente está en un área central, a Laredo, donde creemos que la contaminación de E. coli puede ser localizada. Dentro de una milla o 1.5 millas dentro de uno de otro. Desafortunadamente, esta misma investigación enseña que nuestro problema ha existido por muchos años y ahora estamos tratando de llegar a solucionar el problema que ha llegado a este punto hoy. He pedido que estas áreas que están afectadas sigan teniendo la orden de hervir el agua y las áreas no impactadas que sean quitadas de la orden de hervir el agua. Y actualmente no ha habido ningún laboratorio confirmante que haya enseñado que el E. coli existe en la planta tratadora o donde sale el agua. Sin embargo, como médico, la salud pública y la seguridad del público es prioridad en la existencia de este microbio de E. coli. Probablemente el E. coli no tenga mucho impacto en el público en general, pero tenemos que saber la cantidad de E. coli que existe, el tipo de la bacteria o la cantidad ingerida y la salud de la persona impacta a que si enferman o no enferman. Por eso es importante que estas áreas impactadas deben de hervir el agua por lo menos 1 minuto antes de ingerirla. Estas son la guianza de la CDC. Le digo al público y a mis pacientes que específicamente los niños debajo de 5 años, las personas de edad avanzada y las personas con sistemas inmunológicos comprometidas son los más vulnerables para estas enfermedades. Y como alcalde y mayor, he estado visitando estas áreas de distribución del agua y estoy de acuerdo con el público que no debemos estar viviendo de esta forma. Y también pienso que ellos se sienten no respetados. Creo que como servidor público, estos tiempos difíciles son los que tenemos que estar enfocados en hacer nuestro trabajo. Por eso fuimos elegidos. Yo creo que es la esencia de ser servidor público. Por esta razón, después de la junta de TCEQ que tendremos hoy, voy a pedir tener una junta de emergencia con el Cabildo de la ciudad de Laredo para pedir varias cosas. Voy a pedir que todos los recursos disponibles sean dirigidos a mejorar la infraestructura del agua y esta crisis. Voy a pedir que los proyectos que se dirijan a reemplazar la tubería que ya ha existido más del tiempo que es indicado. Voy a pedir que el público reciba un descuento en su recibo de agua. Voy a pedir una aprobación inmediata para que el director interino de utilidades empiece el 21 de octubre. Y va a ser un especialista interino. Estas son algunas de las cosas que voy a pedir en el Cabildo, pero creo que debemos de tener fe que podemos componer este problema y tenemos que enfocarnos en el problema que existe. Antes de pasar micrófono, voy a dar las gracias a todos los empleados de la ciudad que han estado trabajando fuertemente en el sol, día tras día, donde los he visto, cuando he visitado. Y también quiero darle las gracias a la senadora Zaffirini, a los representantes Richard Raymond y el representante King por su gran colaboración en estos tiempos difíciles y de retos para nosotros. En este tiempo ya le pasaré el micrófono al señor Neb. Mr. Neb.
All right, good morning. Joe Nebb, Laredo City Manager. I'm going to actually let our city professionals talk a little bit more about what our day-to-day operations look like as far as trying to get through the boil water order. And then I'll come on at the tail end and provide you a little insight into our next steps. As the mayor alluded to that, we are working on the long-term resolution as well as how we're handling this in the short term. So I'm going to ask Mr. Garcia to give you an update on what's happening in the field from the utility perspective.
Good morning. Thank you, Mr. Nebb. Right now, currently, our staff is working with TCEQ resources. Also, we've identified, TDM has provided some resources. What we're currently doing is analyzing the locations, doing customer service inspections to try to locate where this source is. We are pinpointing it based on this information that we're obtaining. And once we've identified the source, I think that takes us further ahead. We've increased the amount of chlorine that we're disinfecting, so that way we're able to disinfect the bacteria. Currently, staff is out there also collecting samples. We're doing our regulatory sampling. All our resources are focused on identifying where the problem is and analyzing what the situation is. This can be, like I said, it could be a slow leak, it could be a connection that was done to the system that introduced that bacteria into the pipes. Different things that can happen out there, and we're trying to track where its origin was. It's kind of like we're trying to find that smoking gun. So we continue to work. TCEQ has brought down some of their resources. They're helping our staff provide, like I said, we're doing the customer service inspections to locate the problem, locate the source. We'll continue to do that, and we'll be collecting the samples to lift the boil water notice. That's at least in a summary what we have. We do have this map that identifies the areas that got the hits as far as positives, but we'll continue to work. We've been working day and night, flushing the pipes. Our staff will be out there, TCEQ staff and TDM staff, that volunteers that have come in that drove overnight last night, and they're here to give us the support, and I appreciate that effort, and I really appreciate TCEQ working with us. And again, we also working to remove certain areas out of the boil water notice. There's information that I need to submit to the state. We're working on that continuously. That's all I have. I don't know if there's any other information.
Good morning, everybody. Assistant Fire Chief Cesar Rodriguez, Laredo Fire Department. Distribution continues throughout town. Today we have Grace Bible Church at 9901 Springfield Avenue, set to start at 9. It has already started, and so we'll be there until supplies last. Followed by 6 p.m. distribution sites at Laredo Health Department, Maryland Entrance, Father Magnible Park, and LC South. So these efforts continue. We try to space them out throughout town so that we can cover the whole city. You know, we move sites around based on the location and what works for us. Home deliveries continue. We're taking 311 calls from. We're taking calls from 311 and to the elderly and the disabled. So these operations will continue as needed, and we ask for your patience, and we ask for the people to help out and be patient with us. That's all I have.
Good morning, everyone. I just wanted to reiterate the statements made by the mayor just a few short moments ago. One of the foundational and core functions of public health is to track and monitor disease trends in the city of Laredo. Our epidemiology team does that in conjunction with our public health emergency preparedness team on a daily basis. There is a list that's provided to us by the Texas Department of State Health Services known as the Texas notifiable disease conditions list, and as of today, based off of that list, and there is a species of E. coli that is on that list, we have no confirmed cases in the city of Laredo for E. coli as per the Texas Department of State Health Services list. We have heard that there are individuals who are reporting that they do have diarrhea or vomiting in the community, or they feel a little uneasy. I do want to make them aware that they are able to also source information from our wastewater surveillance report that is posted on our website every week. And from that wastewater surveillance report, we have noticed that there is an increase of prevalence of the viral load of norovirus in the community right now. And norovirus is synonymous with diarrhea and vomiting, and that is of high levels right now in the community. So with that, we do want to make sure that the public is very much aware that our epidemiology and public health and emergency preparedness team are ensuring that any reports are being investigated, and we are corroborating that with the map that has been provided by the Utilities Department. Thank you.
All right, and as you can tell, with all of our people working diligently in order to resolve this, we will get through this. I believe that that as we continue to isolate down the areas of where these contaminants are, we will find the solution to that very shortly, and we will get through the emergency itself. But that's not where it stops. I think the mayor alludes to it a little bit, that aging infrastructure happens in a lot of other cities. The connections and all of our policies, they do fall out of favor at times. And so the goal for what the mayor is alluding to and what the city council is supporting is to find a long-term solution. This last budget, we put over $100 million into the budget for water and sewer repairs. What's being discussed now is to assure that those funds that we have outlined out there are going to the most important areas that we've discovered through this boil water notice. And so we will be talking about adjusting all of our plans from what we thought they should be to what they really need to be. Along with that, Mayor had mentioned we had been working for a little while on making some adjustments within the utility, and that goes back 4 to 5 years through the structure of the utility, trying to make sure that we have the right personnel in the right positions in that. We are shorthanded on engineers within the department. We rely heavily upon outside engineering firms to help us take care of our service. And so we do have a gentleman coming in on October 21st to begin. I'm hoping that the council will support and ratify the city management decision to bring in essentially what I would call an interim executive director and a performance consultant. They will go through the entire operations all the way from the day-to-day operations, all the way through the projects, all the way through the consultants and the contractors that we are currently utilizing to make sure that we are focused on the health and safety of our people at all times for the utility. I do want to just take just a moment here and say thank you to our staff and everything. They have been very active and very busy. We do have a few of them that we're trying to send home for a little bit so that they can get a recovery and so that we can bring them back and continue on. But I think what we're optimistic about within where the testing has been and everything, we are isolating down to the area, and we're very optimistic that we'll be able to provide the justification to TCEQ to at least reduce the impact on our city as a whole. And hopefully release it entirely from the boil water notice. But we are preparing our long-term plans as well as the short-term, and so I just want to make sure that you have that confidence in us to get that accomplished. Thank you. Take the questions afterwards if nothing else. We'll stick around and do the questions.
Okay. Questions individually, please. We thank you for your time and for your attendance.